In your opinion, what sorts of ways do we need to try to, think outside the box to sort of address this issue? Obviously, I thought it was interesting that the fact that you're looking at two drugs that have already kind of been previously used in general, but what sort of out of the box, ways can we sort of address this issue?
Well, mirtazapine is one of the very, very most commonly used drugs, and since it's been shown not to work for depression, then it must only be being used for agitation in dementia. I think that it's time to take a little step back with respect to agitation in dementia. If you think about the things that cause agitation, it's a very broad and complex group of things that are about social adaptation to dementia, about the reaction of people to the memory problems that they have, and the reaction of others to people with dementia. And actually very little of that is likely to be treatable with medication. In fact, the medication that we use in order to take advantage of the side effects of those medications. It is the sedative properties of almost all the medication that's used that we use in order to help treat agitation. And that's not a complex answer to a complex problem, it's a simple answer to a complex problem that is wrong. So I think that we need to take a step back and ensure there are the non-drug treatments, which are about good quality multidisciplinary assessment, that are about working out what the problems people are having and coming up with imaginative solutions. One of the things about the SYMBAD trial that I think is really interesting is that there was really important and significant improvement in all of the groups over a year's period. So that's people receiving mirtazapine and carbamazepine, but also placebos, and not to do with the drugs, but actually there's improvements. And I think that improvement was because of the treatment as usual that our participants received. So they were all receiving, to begin with, the assessment and treatment of specialist older people's mental health services largely, who discussed the problems, who tried to work out what was causing those problems, who tried to provide people with care and support. And I think that if we provide people with psychosocial care and support, which is actually what they need, in addition to providing with the drugs they need for their Alzheimer's disease, then that's the way forward. I think that looking for a magic single drug that will get rid of this complex problem is actually failing our patients.